Hi, guys. Hello, everybody. I hope all is well. If you can hear me, if you can see us clearly, please give us a thumbs up or say something in the comment section. This way, we're sure that you can hear us because we have lots of good information for you today. I'm here with Dr. Sal. Dr. Sal, thank you so much for joining me. I know you're very busy, yet you made time for us, and it's really, really appreciated. Thank you so much.
Always a
Um,
pleasure. Thank you for having me.
all right. So, just before we start, can you tell us a little bit about yourself?
Yes, my name is Dr. Salome Redu. Um, Many know me as Dr. Sal. I am a pediatrician by trade. I also have training in adolescent and child mental health. I work as a pediatric hospitalist in Guelph, and I also work in rural parts of Ontario as a pediatrician. Working in the remote parts of the province.
Oh,
That's really what keeps me busy most days. I'm a social commentator, a conversationalist, um, and I love to share information and learn
mhm,
because I think that's really the only thing that keeps us going. So
that's right.
that's really a little bit about me. I mean, there's a lot more fun side to me, but that's what I can give you for now.
Okay, all right. Well, at least we know a little bit more about you than we did a few minutes ago, so that's good. Um, so today I'd like to talk. I would like to discuss with you meningitis because we had in the month of February, we had two cases in Quebec where one of them ended in death, unfortunately, and one of them was working in a school facility well, I mean, in terms like elementary school. And when this happened, parents obviously started to be worried, question a lot. And so today I had the opportunity to speak to one of the nurses in Quebec. We have Info Santé, they call it. I don't know if it's the same thing in Ontario, but if for quick health service, you can call them, and instead of wasting time or going to the emergency, you can go there for first aid kind of thing.
Okay.
So when I spoke to the nurse over there, she explained to me that yes, it's the pipeline. They will be going to school to vaccinate children against meningitis. And so I just want to talk to you about it so you can share your knowledge with us, what it is, what caused it, is it preventable, is it treatable, is it a lifetime thing? Let's talk about all of this.
Yeah. Um, so, I'm not an infectious disease specialist by any means, but I will share with you the knowledge that I know about meningitis. Essentially, it's an infection of the meninges, so that's why it's meningitis. Meninges is the protection of the central nervous system, the brain.
Okay,
So the central nervous system is essentially the brain and the spinal cord.
okay,
Now, the protection of the brain and the spinal cord involves three layers. So the first layer is called the pia mater. The second is the arachnoid mater, and then the third is the dura mater, which is the toughest and outermost layer.
okay,
So this helps to coat these three layers coat the brain and the spinal cord to protect it.
okay,
Underneath the layer of the arachnoid is fluid. So the point of the fluid is to coat the brain, give it a cushion to protect it, to help blood flow, exchange of electrolytes, nutrients, things like that,
okay,
and essentially works to protect, guard the brain, provide nutrients, fluids in and out.
okay,
Um, so underneath the layer where there's fluid, if a pathogen, a bacteria, a virus sneaks in, it could possibly cause an infection. It's very heavily guarded, very heavily guarded by the brain, by the body. So there is something called a blood-brain barrier. There are very few things the body will allow through there,
Okay.
and only very few things can sneak in. If a pathogen is small enough, and if there's a large amount, for example, in the blood, it can sneak into that little into the blood-brain barrier
Okay.
and cause an infection of the meninges, which we call meningitis.
Okay.
Now, where it starts from, essentially, it starts from here, the airway, nose, throat. It can start from the gut, um, and it can start from the reproductive system as well, depending on the type of pathogen when they're located.
Okay.
The most likely pathogens that you're going to see that cause meningitis are Neisseria meningitidis, um, Haemophilus influenzae. Don't get caught up in all the names. You
Right?
don't need. You're not a microbiologist. You don't need to know all that. E. coli. I think most people know about E. coli.
Yes.
Um, so depending on the age demographic, E. coli meningitis can occur in usually the very young and infants.
Okay.
Neisseria meningitidis is essentially happens in teenagers.
Mm.
Um, and H flu essentially can happen with across demographics, Haemophilus influenza. So these are like the bacteria that can cause sort of meningitis, depending on how the person is exposed, their age group, and things like that.
Okay.
So essentially, if you're exposed, you're unvaccinated, or you don't have a booster, or you're immunocompromised, once it goes from your nose or gut area is what we call colonized. So once the bacteria gets in those areas, you become colonized. For
Okay.
most people who have a good immune system, strong immune system, nothing tends to happen.
Okay.
Many people are colonized by these pathogens, but they don't really cause them a disease.
Okay.
Um, if you are immunocompromised, or if the amount that you're exposed to, the dosage is large enough, you can get infected.
Okay.
Now, the infection can stop at that place. It can just not progress any further. Or if the immune system does not deal with it, or if you're immunocompromised, it can go into the blood.
Okay. And that's where it becomes a problem.
Exactly.
Okay.
And so you can have an infection in the gut, or you can be colonized in the gut. Nothing may happen. Nothing most likely will happen.
Hmm.
You can get colonized here in the nose or throat, and again, nothing may happen. Um, but once it moves into the blood, now it's at a different, more dangerous stage.
Mm-hmm.
And if again at that point it's not dealt with, it crosses the blood-brain barrier that I talked about,
Mm-hmm.
and that's when it goes up to the meninges, the layer with the fluid, and that's when it can affect the brain.
Okay. I see. So once you become infectious to this virus, what are the signs?
Okay, so many people are what we call asymptomatic, don't have any symptoms.
Okay.
So they might be more colonized than infected. So the pathogen is there, but
Uh-huh.
they're not infected because their immune system is strong enough where it can fend it off, or just create a barrier and keep it where it belongs, prevent it from progressing.
Right.
These people can infect other people.
Mm.
Now, even though you're asymptomatic, people can get it from what we call droplets, respiratory droplets. You sneeze, you cough, expose somebody else. They inhale it. Um, they can then, become sick depending on, the level of immunocompetence or how
Right.
strong their immune system is.
Mm-hmm.
Once you do get infected, you'll show signs of um, vomiting, headache, fever, um, lethargy, or just being tired all the time, generally feeling unwell. And
Okay.
this isn't like a small fever. I'm just gonna take like Tylenol and it
Oh
goes
no.
away. This is a fever that's like persisting. It's very high fever
Okay.
because the it's if you're dealing with meningitis, the body is sensing, okay, this is very serious.
Hmm.
And so the point of a fever, raising your temperature level, is basically to raise your body temperature where the pathogen cannot, or the bacteria, virus, um, cannot be able to withstand that high body temperature.
Hmm.
So it will raise your body temperature really high. And then you feel a wicked headache, like a really
Hmm.
bad headache, maybe one of the worst headaches you've ever had.
Okay.
Not comparable to say a migraine headache or the usual headache that you may have.
Hmm.
Sometimes dizziness, lightheadedness.
This is
Um,
serious.
it's very serious.
Hmm.
So if you're starting to show that sign, um, it's getting late in the game. It's something that you need to seek medical attention immediately.
Okay. Okay. All right. So those are the signs. So if we're feeling or seeing our kids having these symptoms, it's a red flag right there to take
Yeah,
action. Okay.
immediately.
Hmm. Can this be repetitive? Like, can you have it more than once in your lifetime, or once
Yes,
you have it? Oh, okay.
yes, you can. Um, like I said, there are different pathogens um, that cause the infection. And so
Hmm.
if you've been exposed to, say, Haemophilus influenza, you're not necessarily exposed to Neisseria meningitidis, which is a
Hmm.
different pathogen altogether.
Okay. So now you're introducing another type.
Yeah, exactly.
Okay.
Now, the different bacteria, you're exposed to something different. So you might have
Right.
immunity against one thing, but you may not have immunity against another.
Mm-hmm.
Also, if you've been vaccinated and you require a boost and you don't have a booster, um, or if you get sick and you're immunocompromised, like you have an illness that makes you susceptible or makes you weak to a pathogen,
Mm-hmm.
that also makes you more vulnerable, even to the same thing that has infected you before. So
Hmm.
yes, you can get it more than once in your life.
Okay. I see. So now that is in the pipeline that our kids are going to be encouraged to take the vaccine in school, which personally I think it's a great idea. Their friends are there, they see one do it, they'll be more encouraged to do it, they'll be less afraid. I think it's
Yes.
really a good idea. Um, how do we Okay, how is there like how do we introduce or talk to our kids about this to prepare them? I can't hear you. No, no, I can I only read your lips, but I cannot hear you. I don't know what happened, but I cannot hear Dr. Sal anymore. I'm sure he's going to try again to reconnect with us. But basically, we're talking about meningitis, and he has explained to us that it's um, it's a virus that gets into our system. It can go in through our nose, our mouth, or even the stomach, and so once it gets inside of us, normally it's not a problem, but it becomes a problem when it gets into our blood. So once it gets into the blood, then it travels towards where the brain is, and that's when if you don't seek or consider medical attention right away, it becomes very, very, very deadly. It's something not to be joked with. Um, and so he's, as a pediatrician, I thought it would be a great idea to talk to him and see how we can prepare ourselves. And because right now Quebec they're planning to vaccinate the kids in school, and so this is a really good step for us to learn how we're going to talk to our kids about it, to introduce the whole idea and what to expect after the vaccination is done. I see that Dr. Sal is back. Dr. Sal, oh, you're back. You're off. Your screen is okay. Dr. Sal, something happened. We lost him again. As you saw, he's at work, and so anything can happen, right? Um, he's given us the little time that he can to elaborate on meningitis to us, so that we can be ready and prepare for. Now, if you have any question, guys, please put them in the comment section. And if you can hear me or you're having trouble hearing me or seeing, please let me know, because I'm not on the other end. I would not be able to. And the reason for us being here is to give you information, and we want to be able to do exactly that. So if there's anything hindering that, please let us know. Welcome back, Dr. Sal.
Thank you. Can you hear me?
Yes, I can hear you now.
Oh my gosh, I'm so
Uh,
sorry.
Don't worry, it's okay. So, you were well, I was saying, I was asking if there's a better way, or if you can guide us, how we can talk to our kids about this to prepare them for the vaccination.
In terms of the illness or in terms of how to be ready for to receive a vaccine?
Both.
Okay. um, I mean, I think depending on the child's age, you might have to just talk to them where it's age appropriate. If
Hmm.
you're talking to a teenager, you may be able to tell them, okay, the brain has a layer around it called the meninges, and an infection of that is called a meningitis. And so what we're doing is we're giving a vaccine so that your body will have immunity to be able to fight against meningitis.
Okay.
Of course, if it's a younger age child, a school age, like say a 5-year old, you might just need to maybe use a doll and kind of
Okay.
explain using the doll, saying,
Mm.
okay, they have a boo boo on their head and they need to get medicine. And the medicine has a small, like, you feel a small pinch, a small owie, and then, you feel better, something
Okay.
like that. So kind of
Oh, that's
demonstrate
nice.
using that. Yeah.
I like the idea of the doll. I didn't think
Yeah.
of it. I'll use it for sure. Okay,
Yeah.
that's very good. Okay, so is this common in children or older folks also?
So this will depend on the age and the level of immunity. So again, younger infants, you'll see more the Haemophilus influenza bug or the E. coli if they're infants. That can cause that E. coli meningitis in kids. Um, the older kids, the teenagers, usually will be the Neisseria meningitis. That will be the one that causes more of a havoc in them. And then the older people, it is the ACYW group um, that will cause.
I don't think we know what that is.
So, so there are different strains of the bugs that can cause meningitis in
Okay.
groups ACYW.
Uh-huh.
Um, Men C usually will vaccinate when you're a toddler, I think around 18 months.
Hmm.
And then groups ACYW, which kind of, we group them together.
Hmm.
Um, that one you receive around high school age, the Menactra.
Yeah.
If you receive it once, usually you have a lifetime immunity. You don't need to get it again. If you receive it earlier, sometimes you need a booster. If you receive it as an adult, you only also need it once,
Okay.
because it covers, those are the main strains that it covers. There is a B group,
Okay.
which is also given later, I think 16 and above, from NB, meningitis B,
Okay.
that protects against that strain of meningitis. So
Okay.
that's another strain sort of that we vaccinate against depending on the age group and the level of exposure. So those are college age kids.
Okay.
Usually It's people who live in close quarters that tend to share the bug. So if I think they used to say military barracks or people who lived in military areas live together,
Mm.
or live in dorms. So people who live in dorms live with roommates because they're in close quarters. They share the same sort of vicinity, same air. They have a higher level of being exposed because
Okay.
they live so close together.
So
Or
close
like
together.
refugee camps,
Hmm.
areas where any areas where people really live close together, they have a chance of sharing the bug.
Okay. Okay. All right. So now that my next question will be, now we know how to introduce this idea to our kids and prepare them for the vaccines at school. For those that are homeschooling their kids,
Yeah.
because now it's a popular thing to homeschool your child after
Mhm.
COVID. It has become very, very popular. Those parents, what measures can they take to get their kids vaccinated? Is it, do they have to see their doctor for a prescription, or they can simply walk into a clinic and ask to be vaccinated? How would that work?
So I think in Canada it is province dependent. It depends on which
Okay,
province you are.
okay,
But for your family doctor should be able to prescribe
okay,
this vaccine, and you can go to the pharmacy and have it done there, or they can do it at the family doctor's office.
okay.
I wouldn't say just because you're not in a school system that you shouldn't vaccinate your child, because
Mm,
of course you have family members who also could potentially be exposed and
right,
could potentially be a host to
exactly.
whichever bug can infect you. And so I would still recommend that you still get your full vaccinations regardless of whether you're homeschooled or you're in a public school setting.
Okay. Now, my other question is, we're preparing our kids to go for this, to take the vaccine. What should we expect after vaccination? For how long should we expect any change, if there is any?
Okay. So after the vaccine, usually the immediate reaction that you get is the injection site reaction. So a little bit of inflammation, redness, irritation at the injection site. They might have a low grade fever.
Okay.
Um, so it might be sort of, for I say 48 to 72 hours, and it's usually responds to Tylenol or Advil.
Okay.
Um, so those are usually the signs that you get. It's a killed vaccine, so it's not a live vaccine. So you're not worried about infecting by getting the vaccine.
Okay.
Um, so just people looking being tired, feeling a little bit feverish, warm. Of course, the injection site redness and irritation. Those
Mm,
kind of reactions that you expect from the vaccine.
okay.
Typically, within
Uh,
a week, all the symptoms should subside, and then within a few weeks, you should have immunity. You should have some response from the immune system in terms of immune memory.
mm, okay. Perfect. So now we know what to expect after our kids are vaccinated. Now, my other question is, moving forward, since you mentioned that this is not a one-time thing, it can repeat itself throughout your lives. What are the preventative measures that is there for us to take?
First important things: make sure you have all sets of vaccines.
Okay.
You don't need to be vaccinated every time there's an outbreak. If you've been vaccinated at least once against the ACYW, usually you have immunity, um, and you don't have to be vaccinated every time. But of course, making sure you wash your hands. If you think that there's a potential for somebody to be exposed, I would wear a mask at home,
Okay.
um, especially if you live in close quarters with somebody who may be sneezing, coughing.
Hmm.
Um, that you might be exposed to that person. If they have like high fevers, all those things, especially in the setting of an outbreak, and you have that concern, I would do that. Hand
Okay.
washing is always advised. Always wash your hands. And if you feel like you also may potentially have symptoms, then you should also try to prevent others from being exposed to you.
Right.
As a person, as
Hmm.
as a good global citizen, also
Right.
try to protect others from yourself. So hand washing, making sure you have your full set of vaccines. And always eating well and keeping well, exercising, um, will help boost your immune system.
Okay, perfect. So we're all making notes at the back of our heads to keep this going. My other question would be, some people do not believe in vaccination. Fact, whether we like it or not. Some people would not vaccinate. What suggestion or what advice or what can you tell these people?
I think it's always a tough and sensitive subject. You don't want to approach it where you're being condescending in terms of you speaking with people about it, or dismissive of people's concerns, because people do have genuine concerns from
Mhm,
what they've learned. um, I would first and foremost say, whatever source that you're reading from, just make sure it's a reputable source. um, you're looking at randomized controlled trials which are evidence based, and you're not just reading from some blog or someone who's not uh, a physician or a healthcare practitioner,
mhm,
and is um, giving biased information based on what they feel or
mhm,
believe, because this is not a matter of belief. Like, it's not you have a different religion, I have a different religion, I
mhm,
believe something else, you believe something else.
mhm,
The evidence is overwhelming.
mhm,
um, Mortality from meningitis was very high, in times prior to vaccination.
right,
And it plummeted after vaccination. So it's very
right,
clear. That is
right.
not fluke. It didn't happen by accident.
Mhm,
That is due to a methodical effort to vaccinate and to have the whole community have what we call herd immunity, which is most of us are vaccinated, most of us have immune response, and so the chances that it affects any of us is actually very small,
mhm,
such that we don't see these outbreaks.
mhm,
So us seeing two people and starting to panic, that in itself is evidence that this vaccines have worked, because
mhm,
before, people just died.
right.
People just literally dropped dead from
Mhm,
having meningitis. Like, we didn't know what to do.
right.
After we started vaccinating people, it's not even a problem now. Now we can take it for granted and say, well, we believe or we don't believe. We can take it for granted, sit back, and actually create a value and belief system around it, because it works so well
Mhm,
that we don't even think it's a problem anymore,
mm,
right? But we,
mhm,
we cannot allow ourselves to go back to the place where there is so many of us that don't have the vaccine, and these outbreaks
exactly.
are all happening time and again.
Mhm,
Yeah, it's preventable, and we should do that. We should prevent
okay,
that.
okay.
Even measles, you're starting to see diseases that are preventable coming back.
Yeah,
We're seeing cases of measles again. Even in some places, you're seeing cases of diphtheria, polio.
yeah.
Um, it's really, really quite rather unfortunate, because these are all diseases that we thought, okay, we put behind us.
Mm,
But then, there are always pockets of cases, and every time there are pockets of cases, if this is evidence that we should vaccinate, anytime there's pockets of cases of outbreaks, it always happens where people are
right,
unvaccinated.
right, exactly. Okay. So then my other question is, I read about some sort of a booster for meningitis vaccine. Can you just talk to us a little bit about it? What it's called? If we take it, is there a price to it, or it's free, or depends?
So again, like I said, if you've been vaccinated, if you've had the complete set of your C as a toddler, ACYW in the high school age, which is the Menactra or the booster, at a later age, you don't need to have it again. Usually, you have immunity. There's also, like I said, the B, which you get it later. The ACYW and the earlier Men-C, those are all covered usually under the provincial um, immunization record. So those are usually covered. I think the B, you pay for. And if you don't get the ACYW, usually through the usual routine vaccinations, I think if you get it later, you have to pay for it.
Okay.
If you get it through like a public, like what they're doing now, which is when they're going to schools and vaccinating everybody, you don't have to pay for that.
Right.
But I think if you do it privately, um, through like a prescription, you when you go pick it up as a prescription at a pharmacy, you may have to pay for it.
Okay.
So it
So,
depends on what the province covers.
okay, perfect. All right. Viewers, if you have any question, please put them through because I'm running out of my questions. And we have Dr. Sal here. He's so hard to get. So now that we have him, let's exhaust him, okay, guys? No, but on a lighter note, I do really appreciate your time on this. It has given me, and I'm sure most of our viewers, a better understanding of meningitis because we just heard about it. The two people were infected, one died, and one was in school. Parents are freaking out. Everybody is going
Yeah,
out of
yeah,
their mind. So now we know what it is. We know what we can do to prevent it. We know how to conquer it with vaccination. And so I think it's a really good session that we've had. Um,
yeah, for sure. I think, and I'm always grateful to be here to talk to you and everyone else. One thing we didn't talk about was the treatment, I think. And
right.
usually, when you get meningitis, the treatment is IV antibiotics.
Mm,
This isn't something you can stay at home and treat.
mm-hmm,
It's very serious, especially that means basically the most sensitive of the body's defense system has been broached.
right.
That is that is the brain, the blood brain barrier that I was talking about.
Mm-hmm,
Once that defense system is affected, it's open season because your brain is like it's like a car where the engine has been compromised,
mm-hmm,
right? It's like someone throwing salt in the engine oil.
mm,
Once that salt runs through the engine oil, forget it.
that's it. Yeah.
It doesn't matter what you do, you cannot treat it unless you drain it of everything and restart the vehicle and start everything over again.
Mm-hmm,
Likewise, once you have an infection, you've got to go directly to the source. You have to go to, it has to be IV antibiotics. If it's very severe, they do something called intrathecal, which is basically
okay.
going directly into that space I was telling you about
Mm,
to inject it right directly there
mm,
to fight whichever pathogen, whichever bug is causing the meningitis. So it's very serious. It's not. This isn't something you stay at home and treat. This
that's
this
it.
has to be treated in a hospital setting
And it
by
doesn't even
trained
sound like
professionals.
a day or two treatment at the
Oh
hospital
no,
either.
no.
Yeah.
Mm-mm. This
Mm,
this is a 3-4 week
that's
treatment. So you
okay.
might not be in the hospital for 4 weeks,
Mm,
but you might be in the hospital for maybe a couple weeks, have IV antibiotic, but you might when you go home, you still might have an IV in, and a
mm,
nurse might need to come to your house to give you treatment every day,
right. Okay.
and depending on the severity of your illness.
Mm,
And usually there is some sort of every illness once you've cleared it, there's some residual risk of some things that might be permanent.
mm.
Okay, for meningitis, it's you could be deaf.
Oh, really?
Yes, it could lead to deafness, because it affects parts of the brain and the brain stem functioning, and then it could also lead to possible seizures
Mm,
in the future,
okay.
arthritis,
Mm-hmm.
as like a residual health risk. And so that's something that it's something you have to take seriously. The best thing you can do is prevention. Don't get it in the first place.
Exactly.
And vaccines have shown to be very, very effective. And
Mm.
so if you're not, get vaccinated. Go back, check your records. I know a lot of us haven't checked our vaccine records for a long time. Check your records, see if you were vaccinated. If not, get your shots.
Talking about
Um,
that, if you had gotten the vaccination before but don't remember or don't have the record of it, whatever the case is it can you do it again, or
yes,
it doesn't matter if you get it twice?
nothing will happen to you.
Okay.
It'll just be better immunity.
Right.
It'll just be
Okay.
better. It's harmless.
Uh-huh. Okay. All right. Better safe than sorry, right?
Yeah. I would
Okay.
say if you cannot find your records, you don't know, get your shot.
Exactly. Okay, perfect. No comments coming in. And so, on this note, if there's anything that you'd like to share with us on this topic that we did not touch, please do go ahead and share.
Yeah, I mean, I think there's also currently we've seen outbreaks of strep throat, strep
Okay.
pharyngitis
Mm,
in Ontario.
okay.
And so that's another thing that parents should be aware of. So if you have a child who's coming in, they complain of a sore throat, fever, generally feeling unwell, things like that, you have to take it very seriously, and get them seen by your doctor,
Okay.
um, and get them treated
Hmm.
if they have strep throat or strep pharyngitis. That's what we call it.
Okay.
Um, so that's something that's very important. If you're not treated in the time that you should be, after the infection passes, there is a chance that it can affect other organs. Even though it
Mm,
starts in the throat, it's not harmless. It can affect the kidneys,
mhm.
and your kidneys. You could start seeing a child that's peeing like Coca-Cola blood.
Ah,
Yes, so they start peeing and the pee turns black, and you're
oh,
wondering what's going on. Why is my baby peeing all
mm,
this strange color?
it's
It's it's because there is something wrong with the kidneys, and sometimes it's from the infection in the throat that goes to the
okay.
kidneys, because of the residual inflammation. And so it's very important to get it treated when it should be treated instead of waiting. So if your child's complaining, especially in places, I think there was an outbreak in Quebec as well, and BC. Um, that's something that you should take seriously. Get your doctor to see the child, get
Mhm.
your healthcare professional to see the child, and have them treated in a timely manner so that they don't have the fallout of
Right.
the other things that can affect the other organs.
Okay, perfect. Well, it's also noted because I didn't know about this one. So in summary,
Yes.
in summary, please summarize it for us in like a minute of
Okay.
everything on meningitis.
Meningitis is an infection of the meninges. That's the protective layer of the brain.
Mhm.
Your brain is surrounded by three layers of protective covering, and there is a layer that has fluid. And when bacteria get in there, that's when they can infect the meninges or the covering, the protection of the brain. And it's very serious because, of course, your brain is the center of your body. Your brain is the engine. And so it's a very serious infection that is treated with IV antibiotics. It starts from infections from the nose, throat, sometimes in the gut, that can go into the blood, and then from the blood into the fluid that covers the brain. So from the blood to the brain.
Mm.
The best prevention: vaccine, vaccine, vaccine. Get vaccinated, get vaccinated. Make sure you check your records. Make sure that you've had your shots. And of course, hand washing. And it's common. The outbreaks are usually common in places where people live in close quarters, like um, when they go to school. If they're living in a dorm, they're living with roommates, people who may be exposed, camps, things like that. Um, and prevention is always better than cure. So, let's be vigilant, let's be preventative, and, let's do the little things that we can so that we don't have to deal with the big ones.
Okay. All right. Sounds good. And guys, if Dr. Sal is always following PCR Girl. And so if you have
Yes.
any question, please do put it in. He's going to answer you. It's not the first time, he's always done it, and we're always appreciative of him. So thank you guys, and thank you so much, Dr. Sal, for your time this evening.
No problem. Thank you so much. I'm really
Uh,
very grateful. It's unfortunate it has to end this quickly, but you know, anytime you like to talk, just let me know. It'll
okay, will
we will
do. You
arrange
know
it
you'd
and
hear
we'll
from
make it
me.
happen.
All
What was
righty.
that?
Thank you. You'll hear from me
Oh
definitely.
yes.
All righty. Have a good night.
Thank you, and you too.
Thank you. Bye.
Bye bye.